So if we do a little math for a second, it takes 5 weeks to be fully vaccinated with the Pfizer vaccine, and that's the only one that's authorized for 12 to 17-year-olds. So if parents are trying to decide right now whether or not to get their kids the vaccine before school starts, they really need to have their questions answered. So I guess if we could start with, what are the possible side effects in children right now?
So right now, the studies in children are ongoing under age 12. The kids 12 and up have all been EUA approved to receive the Pfizer vaccine. So there's been a lot of discussion recently about myocarditis. Myocarditis is an inflammation of the heart. We've seen several cases of that, both here in Stony Brook, as well as around the country and around the world. The CDC has a vaccine adverse event reporting system, and they've been looking at each of those cases that have been reported. The vast majority of those have been kids 12 to 30, and they are associated with shortness of breath and some chest pain. The good news is, for all of those cases that have been reported, the vast majority of them are all home already, most of them having been treated with either Motrin or Aleve. So the good news is we can diagnose it, we can treat it, and those kids are doing remarkably well, with almost nobody having any long-term sequelae. Do we worry about it? Absolutely. But when you think about the COVID virus itself, particularly now with the Delta variant being so contagious, even just a little bit of virus infecting you right away and quickly, and we worry about the cardiac effects or the heart effects from the virus, we have to weigh the risk of the myocarditis versus the risk of COVID-associated heart inflammation, which I'm sorry to say does not get better with a dose or two of Advil or Motrin. So parents need to talk to their physician. Any child that has any underlying cardiac issue should definitely get vaccinated, because the risk of any problem with the vaccine is quite low compared to the risk of getting COVID in that particular population. So an underlying heart issue is not a contraindication to getting vaccine. In fact, it's almost an indication. Please prevent my child from getting sick from COVID.
Now, what about the parents who say, I want to wait to see if there are long-term side effects?
Well, that's true pretty much of every parent for every vaccine. There's always that concern. What are the long-term issues? I can tell you, while we may not have long-term issue follow-up from the vaccines, after all, they've only been out for a short time, even in that same short time, we are seeing the long-term effects from COVID infection. So while I weigh the hypothetical risk of vaccination versus the absolute real, I want to say in our face risk from virus, the virus risks are so real and are happening. Parents are talking about at least 10% of the kids, even those who had an absolutely low-grade asymptomatic infection, still having long-haul COVID symptoms. The risk of a myocarditis, the actual CDC data showed that the risk was about 17 cases per million doses given. So yes, the risk is there, but is nothing approaching that risk from infection.
Now, what about the kids who had gotten COVID, whether asymptomatically or not? Did they really need to get the COVID shot?
Well, the recent paper looked at, if you had COVID and we vaccinated you, were you the same, better, worse? What happened? And really, interestingly enough, if you had COVID and then you got a vaccine, your immune response was better than if you actually never had COVID and just got a vaccine that way. So having COVID, we worry that your immune response may not be long-lasting. But if you get a vaccine after you've had the illness, your immune response was better and your memory immune response was also better. And I think that's what's helping us now to say that if you've gotten the vaccine, you may not need a booster, particularly for those who had illness and then got vaccinated. As you know, 30% of those patients who were asymptomatic but had COVID or low-grade infections and had COVID, 3 months later, they have no immune response. So for sure, we want to vaccinate all of those people.
And when we talk about that Delta variant, right now it accounts for 1 in every 5 new infections in the U.S. That's according to the CDC. And when we take a look at why that matters, there's this idea that it is so much more transmissible. It takes less time and less virus to infect someone.
That's correct. Just a little bit talking about the virus for a minute. The virus has a protein, spike protein, that attaches to cells. It's got 3 fingers to it. The original virus that we had, only one finger kind of was open in the right place to be able to attach. So it was a bit wimpy. And being a bit wimpy, we still saw this huge outbreak, not only in New York, but around the world. This new variant, or the Delta variant, all 3 fingers of that attachment protein, that spike protein, can boom, they're all open, they attach right away. A little virus goes a long way, and it infects quite quickly. Remember, none of our vaccines are 100% for anything for anybody. So when I think about those adults, elderly, people with comorbid infections that did get vaccinated, we still have to protect them against Delta because they can still get infected and possibly still get sick. So when I see people walking around that are wearing a mask, don't mask shame them. They may have been vaccinated and they're still protecting themselves and their loved ones from the variants.
I know right now you're looking for 18 to 26-year-olds, right?
That's correct. Our university study is still up and running. We are still enrolling because exactly the questions that we're talking about today. If you've been vaccinated, how infectious are you? Is the Delta variant there, not there? And how contagious are you to someone else? Are still questions we have to answer, particularly in those college and young adult age groups, which kind of were responsible for most of the super spreader events we saw. So if we have anyone in the Nassau Suffolk area that's interested in joining the study, they have to donate some blood, they'll get their vaccine, they'll swab their nose every day, and we'll see how they do. And we have a hotline number that they can call if they're interested. It's a little catchy. It's 631-638-COVID. We tried to get the D in there, but it didn't work.
Okay.